Welcome to the Ascend Health Show. I'm your host, Nick Angelis. I'm a nurse anesthetist and one of the owners of Ascend Health Center in Fairlawn, and I'm here with Crystal Harper, family nurse practitioner. How are you doing today?
I am doing great, thank you. Thanks for having me.
So we were saying just before the camera rolled that we should just do a morning talk show every day.
Yeah, absolutely.
Where we laugh obnoxiously at each other's jokes.
I think we'd have a lot of them.
Yeah, talk about news that nobody cares about, have pictures of people's pets.
Yeah,
Really
we could add some fun stuff in there.
Absolutely. But I guess nobody's watching this to hear about pets. Although I do have a really nice pet. He's a golden doodle dog. His name is Peanut.
Oh, are those the big ones? Golden doodle?
Yeah.
Okay.
He looks like a deer. I need to put an orange vest on him during deer season so he doesn't get shot.
Yes, that would be important.
Yeah. Anyways, why don't we talk about your practice, KMI Wellness, and how that started.
Okay, so I started the clinic February 8th, 2021. So we just a couple months ago hit our 2-year anniversary.
Congratulations.
Thank you. So I started the clinic really because I was working in family practice at a community health center, and I just was becoming a little frustrated with the lack of time that I got to spend with my patients, and you know, realizing how sick our country is. And I wanted to spend more time with them, and I wanted to look at some alternative ways to treat them. You know, I believe that traditional medicine obviously has a place, but I wanted to look at some more natural methods and maybe try to help them before we have to go to traditional medicine. And so I started the clinic during the midst of COVID, of course, and so
Great timing.
I know, right? So, but we treat a lot of COVID patients, and so it was very helpful. And so we started with just being open, 2 days a week. We've grown now. We've shifted the days that we're open to weekdays, and now we're open 3 days a week, and we continue to add services. So we're located in Ravenna at 128 North Prospect Street. We can be found at KMIWellness.com. We also can be reached at 330-839-8078. And we offer a lot of different treatments, and so there's no specific conditions that we treat. We really like to look at the person as a whole, see what kind of symptoms we're dealing with, and talk about where they're at versus where they want to be.
Sure.
And then how we can help get them there.
Are you ever like, nope, can't help you, this isn't really something that we can move the needle on?
Not really. No, I don't think I've ever had to turn anybody away. I mean, because, we work with a couple of different pharmacies who have made some specialty treatments for us. For instance, we have a mineral blend, we have a Vita Complex, we have an amino blend, and those are just a few of what we have to offer. But, depending on what their symptoms are, magnesium, zinc, vitamin C, those go a long way, and they treat a lot of different conditions. And so, we can treat them based off of what their symptoms are, what their lab values are showing, and how they're feeling.
Okay, great. Because unfortunately at Ascend Health Center, sometimes it is that way. Well, someone will come in for a ketamine infusion, and we'll say, no, actually, you really don't qualify. But then again, being a nurse anesthetist, some of our treatments are more invasive or more, okay, this isn't, like for example, we sent out a postcard about migraines, but we're not at all the first place you go to if you have a headache. We're expecting people who have been to the neurologist and they've been to the chiropractor.
Nothing is working.
And then they can come to us and we'll figure something out for them. So sometimes that is the challenge with what we do, which is sort of generalized, but also very specific at times.
Yeah, I mean, we've had patients who definitely have gone to other providers. They've been to different specialists. They're kind of at their wit's end with different treatment that hasn't been effective for them, or they're just tired of taking so many medications every day, or they've taken this medication, now they have this side effect. So sometimes we have those people who are really just looking for something different. And then we have people who haven't, I mean, maybe they've been to their PCP, but really haven't been to all the other specialists because they don't want to go that route.
Right.
They want to try to do something a little more natural, more holistic.
Is there a good way, and this might be a rhetorical question, most of my questions are really as I think of them, but is there a better way for patients to integrate all of their providers into care? Because it sounds amazing, like everybody on my team is going to get together and they're going to have this meeting just about me and we're going to have all these great ideas, but practically speaking, is there a way that you can connect all these, or does it just not really work?
So it's definitely not like that, where the providers are not meeting, and sometimes we're talking, like I have patients who go to a clinic down south, and so they also come and see me. So, on Tuesdays they're down there, and Thursdays they're with me, and they come every week. Most of our patients come every week.
Sure.
Because we do weekly injections or we do infusions. We do everything in an injection or infusion because we want that to be in the bioavailable form so that everything we're giving you, your body is able to utilize and put to work.
Right.
A little bit different from the oral medications. And so, I will call those providers if it's very specific, like,
Sure.
This is what we are doing. Tell me a little bit about what you're doing. I want to make sure that we're on the same page and that at the end of the day, we're doing what's best for the patient. People, typically I don't talk to their PCPs. I will send over a note of what we're doing, kind of like a consult note,
Right.
Unless we have specific questions about medications or dosages. I had a patient who I was treating their vitamin D deficiency. The PCP also wanted them to start an oral supplement, so I will make phone calls in those circumstances,
Okay. Yeah, that makes sense.
Yeah.
And for us, what we started doing is almost all of our patients, unless they meet with a therapist first for an intake appointment, we'll have their PCP or their psychiatrist or their therapist refer them. So that way, from the get-go, we have an idea of like how to treat somebody.
Yeah.
And it helps too because that way, patients don't feel like tourists. Like they're like, okay, everyone is working together.
Yeah.
But I think it helps also to be upfront with the patient of like, hey, here's what we can do together.
Yes.
Here's some things that you're just gonna have to trust us on because we're the experts in this particular area. So, 'cause, for example, we work a lot with pain management.
Oh, yeah.
There are some pain management places that can do ketamine infusions and have insurance pay for it. Most of them can't. And obviously, usually it's a blend of mental health and physical health that we're dealing with. So a lot of times it's okay, we need to work in lockstep, and pain management is notorious for this is exactly what you can take and what you can't take. So it's important for us to come alongside them.
Integrate,
Or even, I think I was telling you earlier, a lot of times we've done our treatments specifically like a day or two before surgery or a day or two after surgery. Because like you're saying about COVID, there's these hits to our immune system, to our nervous system, unless we're very intentional. Oh, that was a really good word, intentional.
Yeah, very
unless we're
smart.
extremely
Very intelligent today.
we will miss those opportunities to really impact someone's health.
Really, we will. And like you were mentioning the COVID, we've seen them during COVID. We've seen them after COVID. We do treat acute illnesses as well. So, whether it's flu, they're dehydrated, they need to get their electrolytes back in balance, those types of things. But, we've treated patients for the last 2 years consistently with COVID and the immune system. We've had a lot of even rare autoimmune conditions, prolidase deficiency, different genetic conditions like that. And so it is very important to keep that immune system in order. And a lot of times we see that the overdrive, the immune system is kind of over.
Right. And a lot of times that looks like an autoimmune deficiency where it looks like their immune system isn't doing anything, but instead it's so active, it's so scared, it's attacking its own tissues and everything else, and that's why it seems like every single cold that goes around, you'll get it because it's sort of like an army is fighting on 4 different
all the time.
fronts. Absolutely. And I think it's interesting too because that often is the challenge of traditional medicine or standard American medicine, whatever you want to call it. They're not that great at, okay, this hit just happened to your system. How can we recalibrate? How can we get you tuned up before you start having all these unexplainable symptoms that you'll then deal with for years?
Yeah, absolutely. I think, it's challenging in primary care because, you're seeing so many patients and, you've got to be an expert with everything, and, in certain situations you can refer out to specialists, but in certain situations such as community health, sometimes the patients don't have insurance and so you cannot refer them out. So you've got to kind of learn to be that specialist,
Right.
So I think that sometimes it's hard to have the time or the ability to step back and think of everybody as a whole and look at kind of all these different facets, and even just the simple stuff. You get somebody who's coming in for a cold, you treat the cold and then move on, to the next patient. But in all reality, there's a lot of other aspects that should be considered. And so that, is one of the reasons why I started my clinic, because I wanted to be able to just really treat everything, spend as much time with the patients as I need to, and then treat them each as an individual.
Right. No, that makes a lot of sense. And I think that's something that we see too, that especially with the IV nutrition. So is there a particular blend that you use to start out with, or is it just, again, very patient specific?
So we have about 9 different infusions at our clinic. Some of them are very specific. There's a skin, hair, and nail condition. There's mental health. There's like an athlete recovery. So we do have, a couple of generally appropriate for everybody infusions. I mean, except for certain medical conditions,
Right.
Kidney disease, heart disease, those types of things. Obviously, we wouldn't want to overload your system with fluids, but, I do try to customize it based off of what's going on with the patient. So after we do our initial assessment and we talk about what exact symptoms they're having, how they're feeling, what their goals are for care, then, if one of those infusions kind of fit good with what they're looking to achieve, then that's perfectly fine. But, a lot of times I do customize an infusion for them. So, I do have, I would say probably my mineral blend is my most favorite because it treats a lot of different conditions. And so we've got selenium, zinc, magnesium, even copper, glutathione. I mean, there are a lot of different ingredients, but those ones are almost the basis for most of my infusions.
Sure.
Because we use them anywhere from, COVID, the flu, somebody's acutely dehydrated. We want to build up their immune system. We want to build up those vitamin C levels.
Right.
We use them in patients who just don't really have good gut absorption. So they've got irritable bowel, inflammatory bowel, ulcerative colitis, Crohn's, they're dehydrated chronically, or they lack those intrinsic factors to absorb things through the gut. We give it to them intravenously. That way it's there and they have it. We've been seeing an influx of people like post-gastric bypass or similar surgeries where they have to meet those fluid requirements and they're just not able to. So they've been coming to us for that. And
okay.
Yeah.
And that does go to my previous point of like a lot of times there is a surgery or an incident, and if you're not careful with your health, it can be very difficult for your body. And COVID is the example that most people think of, but obviously before COVID, it was known, at least I did a lot of research on it, Epstein-Barr virus, mono, there's a lot of viral infections, a lot of bacterial infections where being a nurse anesthetist, I see these patients at their very worst, and then we assume that they get better, but no, we release them out into the wild. They go back home, and a lot of times they have diminished quality of life, and it can be for the rest of their lives because it's a very critical time to make sure they have the nutrients, that they have the support that they need.
I agree.
So at our clinic, I do magnesium, B12, one or two other things, and we've talked before about trying to combine some of what we do, but often my challenge has been with any practice, especially ones like mine or yours, the weakest link is always the least medically researched thing that we do for people. So what population doesn't need IV fluids? For what people would it just be expensive pee where they just got an IV and nothing really happened?
So, I think our patients who are absolutely very well, we do have quite a bit of them that come in, and they're really just looking for almost like a detox, They're eating the right stuff, they're exercising routinely, they're feeling good, they don't have any health conditions, and they just, maybe once a year, once every 6 months, they want to have a nice little detox, like a Myers cocktail, or we have one for like an athlete recovery. So you're very healthy, you're leading a healthy lifestyle, but you want to be proactive with your health. And so, the infusion that we have is kind of just really enhancing your musculoskeletal system, your immune system, your brain function, your neurological function. So I guess for them, I wouldn't say it's not necessary. It's not, something that you need to have every day, but, every once in a while, maybe once or twice a year, they do like to do that. I would say that's my population who really doesn't absolutely need it. So if they don't get it, they're going to be fine. But if they do get it, I think they would still see those benefits.
Well, the advantage too, although this won't sound like an advantage to anyone watching, is that like it's a needle poked in your arm. So you're not going to get it unless you feel better afterwards. And it's going to cost you money because I assume everything that you do is self-pay.
Yes. Yep.
And I think honestly, some of the most dangerous side effects I've seen is when it doesn't cost the patient money or effort or time. Because I was on a medicine once where the insurance was paying for it. I had a copay card. I was like, yeah, let's do it. I lost 15 pounds, had all these side effects. I was like, it's not costing me anything. I'll do this a little bit longer. But had I had an expensive copay, like the first side effect, I've been like, nope, not worth it. So, and that's what we honestly try to do at Ascend. We put barriers for the patients to make sure that they'll put in the effort, that there's almost an energy transfer of like, okay, here's your part, and then this is what this will do for you.
Absolutely. No, I think that you're absolutely right. You want to make sure that they're vested because, like you said, it's those are sometimes the patients that we see in primary care who come in all the time. They don't have any copays, and so with this, and at our clinic, we are private pay. Most of the time, this kind of stuff is not covered by insurance, although I wish it was.
Right.
I think as we get to be a more forward-thinking country, hopefully that's something that they can work on. But so these people are coming in and they're investing their own money, and it's a lot of money. I mean, if you look at it from a larger perspective, it's not a lot of money compared to what you would pay for, the long-term health complications that you're preventing.
Right.
But an infusion might be anywhere from $100 to $140, and that's for one infusion.
Right.
And I have people who get these twice a week, depending on specific medical conditions. Once a month, once every other month. It kind of varies. But our weight loss programs and our other supplemental programs, they're all private pay. So
right.
I think, and that brings me to another challenge, is that when people don't see an effect after like a week or two, they're like, okay, I'm not seeing an effect. I'm not really sure about this, but
right.
Like we were talking previously, this is something that takes time. Health takes time. There's no magic pill or magic infusion that you're going to just feel better,
Absolutely.
unless you're super dehydrated, of course. Then you're going to feel better right away. But, in all reality, your health takes time,
Right. And there are cases where you can speed up the process, but there's also been other times where it's like, no, that was too high of a dose of ketamine, or maybe we didn't need to do transcranial magnetic stimulation. Well, actually, that's not a good example because that one's really hard to get insurance to pay for. So if the insurance is willing to cover it, you really need it.
Yeah.
So, and then that's another way that, again, there's some barriers that, although it's annoying for us as providers, it actually does serve a purpose of making sure that the right patients get it.
It's getting,
So
absolutely.
It does make sense. And for us too, we deal with a lot of POTS, a lot of autoimmune disorders. But what do we do when there's someone who's trying to pay too much attention to their health? I mean, this is rare. This isn't very common, but this type of person who might watch this show for 30 minutes might also be the type of person that's trying too hard, that's trying to biohack themselves to perfection. So how do we have reasonable expectations while at the same time making sure that no one strays into the type of areas where they could actually hurt themselves trying to get better? And I'm talking about myself too. I've also taken some supplements where it's like, all my hair is falling out, but that's fine. I can do this. I'm here to get better.
Right.
It's just like a reaction of my body. And over time, as I put in the work, we'll drill down to the root cause and we're going to do great. So it's almost like a self-torture sometimes.
It is almost. And I think people think that they're doing well, but you're really doing yourself an injustice because, I think just some of those basic principles, like eating a healthy diet, leading an active lifestyle, exercising routinely, having a purpose for your mental health, for your physical health, having a good routine, good sleep hygiene. A lot of times, there are people who I've said, I don't think that you need that. You appear to be very healthy, and maybe we look at this, maybe we scale it back a little bit. Let's just do some simplified, basic interventions. Because not everybody needs to have routine infusions,
Right.
So I think just being honest with them, like, listen, you really don't need that. And, this is what the potential outcome is going to be. This is potentially how much money you're going to have to spend. And people still will do that,
Right.
But I think just being honest with them and letting them know that you don't need it. You don't want your immune system to be overactive because that's, just as dangerous as not having an active immune system. So I think just education. I've always found that if you can just educate them on really what's going on or what's not going on, then they'll trust you, And so if you can develop that rapport, I think 9 times out of 10, they will listen to you and take your advice.
And because we're not these large practices, it is more of a partnership between the patient provider. We have our psychiatrist, Dr. Molina, nurse practitioners, therapists, and often I will go to recommending therapy. Obviously, it's easier because we have therapists at my clinic, but I think it's also really important. Well, let's get down to the mental causes of this as well. Not in a way that says it's all in your head, but the worst thing that can happen is that you're going to waste an hour of your time in a copay talking to somebody about your problems. So that's part of the issue too. Is like, how can we go with the intervention that's the least likely to hurt you as we're trying to get you better? Because we do a lot of antidepressants at Ascend. They work well, but often that's a month. That's an extra month that you're depressed if it doesn't work. That's an expensive medicine that your insurance pretended to pay, and then afterwards they're like, no, we're not really going to pay that.
Gotta love insurance. So, I think if you get the patients on board and just are honest with them about what the expectations are, they will listen.
That makes a lot of sense. And in some cases, we already touched on this a little bit, but especially about IV, since we both do a lot of IV infusions, obviously the ketamine's IV. But just over the last few years, I've done a lot more with injections. Yeah. Obviously, no one likes getting a shot, but it's still less painful than an IV digging in your arm.
Yeah.
I have one patient in particular where we used to do 500 milligrams of ketamine for complex regional pain syndrome. We do that over 4 hours once a month.
Okay.
And now she'll come in for about 30 minutes and we'll do a tenth of that dose in her arm and it works just the same.
Yeah.
And I have no idea why, to be honest.
Sure.
It doesn't make, I mean, part of it's the way that ketamine works as an NMDA antagonist and as a drug that works on multiple receptors. It does work to shift the nervous system and in some cases even the immune system. But why is it that injections work so well sometimes for patients where just taking a supplement that you got off Amazon won't?
Yeah. Well, so there's a couple of avenues to that question. So there are a lot of supplements out there, there are a lot of companies out there, and not all of them are going to be the best for you. You know, because a lot of these things are not FDA regulated, it's hard to know exactly what's in them. Should the ingredients be on the label? Absolutely. But, you know, there are a lot more that are becoming regulated by the FDA, and so everything has to clearly be spelled out on the label. So that's an important avenue to look at for the patients. The reason that we like to give them in the injections is because, you know, your body doesn't have to go through that hard work of converting it, metabolizing it, the first pass effect, all of that good stuff. Right. So I often find too that even if somebody's coming in and they are well and they're on supplements, they're taking like 5 or 10 supplements a day. That means they're taking a pill every day. And, you know, whether that's making your stomach upset or you just don't want to have that burden every day of taking pills, you know, we can give you a shot once a week and that's your dose for the whole week.
Sure.
And so, you know, that is just a better quality of life for them, you know, and then they feel better. They don't have anything in the stomach to worry about having to eat, not eat, you know, all of that stuff.
So which way is it best to do first? Like, let's try this as an injection, and if it works well, maybe you can eventually get to an oral supplement, or do you do the opposite, where let's just start with, like, you know, some generic version of this, and if you see any benefit, then maybe we'll go to an injection and see the real effects.
Always start with the injections, because 9 times out of 10, the patients have already tried some of these orals before they've come to us, and so we're either not at the therapeutic doses or we're just not treating the right symptoms with the right ingredients. And so I will always start with the injections. Sometimes we do blood work if they don't have any, or if there's certain things that I'm curious about that we need to know, those kind of magnesium, potassium, those real fine ranges.
Sure.
But I always start with the injections, and then, you know, depending on where those levels fall, we monitor them throughout treatment. For vitamin D, for example, you know, we do a weekly injection, and then once we get to a certain level, okay, well, we can take it a step back. Now we can look at maintenance. We can go to every other week, you know, every 3 weeks, and then once we get to a certain point, we do need to start the oral supplementation just to maintain that.
Right. And do you find issues with any ratios of minerals? For example, in orthomolecular medicine, which is alternative medicine, they do a lot of hair mineral analysis, and there's a lot of controversy over whether or not it does anything. How can you tell, well, actually you need more copper, or you don't need that much zinc?
Well, so depending on what their symptoms are, you know, for instance, endometriosis, we use that. You know, I had women coming to me who were just in severe pain all the time, back pain, cramping, you know, difficulties with their menses, anemic, like women who were facing hysterectomies, you know, who have been through everything, tried everything, and they're kind of at their wits' end. You know, the magnesium, the mineral blend works amazing for that. So typically there are a couple of specialty blends that I would use, and they would come in once a week for about, I would say 6 to 10 weeks, and then, you know, we could get them down to maybe having to take an ibuprofen once a month during that cycle time, but no hysterectomy, no other medications. We're not eating ibuprofen like candy. Their quality of life is amazing, and so and, you know, and then, you know, those women kind of just go out into the world, and they'll let me know when they need me again, you know. Should they be on oral supplementation to try to maintain those levels? I would recommend that. Are all of them? No, you know. But that is just a remarkable way of improving their quality of life without having to perform a major surgical operation, you know. Right,
to our point of, like, try whatever is the least invasive, and taking out organs is as invasive as you can
Which is
get.
why, you know, it's hard for me to understand why this type of stuff isn't covered by insurance yet, because it's kind of, you know, the backbones of stuff like this that prevents those further complications and more expenses to the healthcare system. So I think everything is in the works, though.
Yeah, and if you look at the data, it's usually hysterectomies, cholecystectomies where they take your gallbladder out, and hernia surgeries are some of the ones that, when they look at the data, it's like, nope, you could have kept that. It was perfectly fine. Nobody needed to operate on you. But that is the risk. Like when you go to a specialist, a lot of times it's not that they're corrupt, but they're here to take things out of your body. So if there's a reasonable reason to take something out of your body and you're okay with it, that's what's going to happen. So just something that we all need to be aware of. So, and you also do some work as primary care, as you mentioned earlier.
Yep, we have a little bit different of a model. We do direct primary care, so it's like a membership-based primary care. So you have an annual membership, then you get a certain amount of visits included with that, certain amount of labs, blood work included with that. You have access to the provider whenever you need it, I mean, within a reasonable time frame. You know, they can, we manage your medications. It's basically like, I don't want to say it's concierge medicine, but it is. You just have a good relationship with your provider. You're not waiting in the waiting rooms. You're not being able to get in to get care if you're sick. You know, you have that direct relationship with your healthcare provider.
Great. And again, for Ascend Health Center, for those of you who this is the first show you've ever watched, and it could be the last because I'm not always all that innovative and interesting as I speak, but at Ascend Health Center, we do some pain management with ketamine infusions. Mostly we focus on treatment-resistant anxiety and depression. We have a psychologist, therapists, psychiatrists, nurse practitioners. And again, the important thing is to find the specialist that can help you. It doesn't help when you go from doctor to doctor to doctor, or from nurse practitioner to nurse anesthetist. You need to find a home and find some people who will listen to you, work with you, but also know what's best for you, so that it is a partnership. So thanks again for watching the Ascend Health Show.
You are watching WCTV, Wadsworth Community Television.